So in this video, I want to talk about the foot. The foot is going to be a very fascinating structure that we begin the study of human anatomy with. Um, the foot is essentially bearing the weight of the entire human body, from the lower extremity to the upper extremity, the trunk, the neck, the head, everything is bearing its weight on the foot, and the foot bearing that weight into the ground. So, for the foot to be a functional piece of the human machinery, it needs to be something that can accommodate this force all the time, while also being a structure that can adapt and respond. Because not only do we bear the weight on these structures, but we also ambulate on these structures. So the foot can be thought of as both a flexible rod and also as a rigid lever. And it can go back and forth from having the qualities of one versus the other, or some sort of mix between the two. And what do I mean by that? We're going to see. So when I look at this foot, for example, if I take a medial view of this foot from this angle, what I can see over here is that this foot has a natural arch to it that goes across like this. This is going to be the longitudinal arch of this foot, right? It has that natural arch to it, and tying up between both sides of that arch, or both ends of that arch, is going to be the muscles and the ligaments, which run across like this, kind of like a tie rod situation. So I'm going to show you on the board what that looks like. So with this, I want to give you an example of what this tie rod and arch look like. So for example, this is a situation where there's no weight bearing down. We have the arch over here, and then this green is showing you essentially the tie rod, or the base of that arch. This is all formed by ligaments and the muscles that are running across the sole of the foot. All right, that's where this is formed. Now let's say we bear down some weight. We bear down the weight of the entire body. Let's say if you're landing from a jump, for example. Okay, so in this situation now you can see that the arch has flattened out, right? The arch has flattened out. All the force is going down, the arch is flattening out, and then this force that's going out this way, right? Because the principal force gets transmitted down, and then that force gets split into two different directions, and basically that force is being transmitted across that tie rod now, right? So these muscles and ligaments, the tensile force stretches on that, and it gets pulled in those two directions. And this is how this is the importance of the arch of the foot, so it can absorb that shock for us. This is how the arch of the foot forms, and this is also one of the ways in which the foot can act as that flexible, adaptive platform on which we sprint, run, and jump. Okay? Now let's talk about the foot in more detail, specifically about the bones. So when we're looking at this image of the foot and the ankle, one of the main things that we need to appreciate is how the ankle joint is formed. So you can see that the ankle joint is formed by the union of the tibia and the fibula, which are gripping on this bone right here, which is known as the talus. Okay, and they form essentially what's known as a mortise joint. So essentially you could think about it as the head of a wrench fitting in this nut or bolt of the talus into that mouthpiece of the wrench. Okay, so that's going to be your formation of your mortise joint. So another thing that you can see from this angle, from this anterior view of the ankle, is that the lateral side of it that is formed by the fibula projects much further inferiorly than the medial side does over here. Okay, so both of these sides right here are known as the malleoli. So this is the lateral malleolus that comes from the fibula, and this is going to be your medial malleolus, which is coming from the tibia. Okay, and you can see that the lateral malleolus is projecting further inferiorly than the medial malleolus is. Now, what does this afford us in terms of actual movement in our lives, so to speak? So this means that the amount of eversion that I can produce with the foot is going to be smaller than the amount of inversion I can produce with the foot. So eversion looks like the foot basically turning outward, or turning the plantar face of the foot turning towards the fibula, towards the lateral side. And inversion is going to be the opposite of that, which is the foot turning inward towards the medial side. So as you can see, you could try it on yourself right now. When you evert your foot, towards the fibula, it's going to stop at a certain point, and it can't evert as far as it can invert. It can invert much further. The reason for that is because the eversion stops once it hits this bony block. This is essentially your calcaneus and your fibula hitting each other, okay? It's not going to go beyond that point. But over here, there's more freeway, there's more leeway for the inversion, which means that any kind of excessive movement of inversion is going to cause these ligaments out here to be torn, whereas any excessive eversion can cause these ligaments on this side to be torn, right? So what we see is that most of the time, the ligaments that run on the lateral aspect of the ankle, these lateral collateral ligaments, are the ones that get injured most of the time, as opposed to the medial aspect of the ankle. The medial collateral ligaments don't get injured as much as this lateral side. And as you can see, that is because it is much easier to go into excessive inversion, which damages these ligaments out here, than it is to go into excessive inversion, which would damage these ligaments on this medial side. Okay, so that's the reason for that. And we can go into what these different collateral ligaments are. So let's take a look at how these ligaments on the medial aspect of the ankle are formed. So over here, this is MM. This is medial malleolus, but let's not forget that this is essentially the tibia. This is the tibia right here forming the medial malleolus. So the ligamentous structure itself is going to look like one big fan that has kind of a triangular shape to it. You could think of it like that, okay? A big fan with this triangular shape to it. Now, this fan is going to have specific portions to it, right, that are forming it. There's 4 portions to it. There's going to be 2 of them, one which goes anteriorly and one of which goes posteriorly, that are attaching to this bone right here. So this is the first bone that is attaching directly to the tibia, which is the talus, right? So this right here is going to be our talus. So this is going to be the anterior tibio-talar ligament. This is going to be our posterior tibio-talar ligament, okay? Then we're going to have one portion which goes from the tibia to the navicular bone right here. This is going to be the tibio-navicular portion of the ligament, and then the rest of it, which runs down here to go into the calcaneus, right? So this is going to be our tibio-calcaneal portion of that ligament. Altogether, this is known as the deltoid ligament. That's another name that you may find for it, because deltoid refers to delta, which is the triangle shape. So over here, we can take a look at what the ligaments are going to look like on the lateral aspect of the ankle. So these are the lateral collateral ligaments coming from the fibula, all right? So over here, this is the fibula, and this would be our lateral malleolus right here, this projection of bone. This bone right here is going to be our talus, and then inferior to that is going to be the calcaneus. So for this part, there's going to be 3 sections to the bone, 3 discrete parts of this ligament, I should say. So there's going to be 2 of them, again, going back and forth from the talus. So we're going to have our anterior talofibular ligament right here, and then our posterior talofibular ligament right here. And then we're going to have one going straight down towards the calcaneus, and that's going to be our calcaneofibular ligament, like so. Okay, so anterior talofibular, posterior talofibular, and calcaneofibular. This guy right here, the anterior talofibular ligament, is the most injured ligament in the ankle. Okay, 9 times out of 10, it's going to be this guy that's injured. Again, this is because lateral side, right? The ankle is designed in a way where excessive inversion is more likely than eversion, which puts these lateral collateral ligaments at risk. And out of these 3 that make up this whole ligamentous structure, this portion right here, the ATFL, is the one that is most implicated in injuries. Okay, So now that we have that down, we can understand how the ankle joint is formed, the main ligaments that support the ankle joint, which would be the collateral ligaments. Now let's talk about the bones of the foot themselves. So we can divide the foot grossly into three different sections, being the hind foot, the midfoot, and then the forefoot. The hind foot is going to be the portion that is made up mostly by the talus and the calcaneus. And then the midfoot is the portion which is the rest of those tarsal bones. And then the forefoot is going to be the metatarsal and phalanges. Okay, so hindfoot is going to be calcaneus and talus. We noted that the talus, right, is articulating directly with both the tibia and the fibula. And then when we look over here, especially from this lateral point of view, what we can appreciate is that the talus, right, is articulating with the calcaneus on its posterior end over here. And then anteriorly, the talus is articulating with this bone, which is known as the navicular. Let's bring this up closer so you guys can get a more zoomed in view of what's happening over here. All right, might as well sit over here. So what we see from this view is essentially the talus articulating with the calcaneus on its posterior end, and on the anterior end of the talus we see it articulating with this bone, which is the navicular. Okay, it gets the name navicular because it has this U bow-shaped kind of structure to it like this, and this is the reason why we call it the navicular. If we look on the medial aspect of this foot, what we can appreciate is the same thing. The talus articulating anteriorly with the navicular bone, and then we see its articulation with the calcaneus right over here. Okay? The talus and the calcaneus make up the hind foot. From this point forward now is all forefoot. Another thing that we can appreciate from this medial aspect is going to be these grooves which are formed over here on the talus. Okay? And this is going to be the grooves that are now where you have the, what should I call it? This right here is another groove known as the sustentaculum tali of the calcaneus. And these are grooves that are going to be receiving the tendons from the muscles that come from the posterior compartment of the leg. Those are the deep muscles of the posterior leg. So that's going to be your tibialis posterior, your flexor hallucis longus, and your flexor digitorum longus, which will all be traveling through this tunnel that lies posterior to that medial malleolus. This is your tarsal tunnel. Okay, all those tendons are running on this medial side, go through those grooves to then reach that plantar side or the underside of the foot. Whereas on this side, when we look on the lateral side, we can see that there's also going to be grooves formed over here. There's a groove right here, there's a groove right here on the calcaneus, and then there's another groove right here on the underside of the cuboid. Okay, these are going to be grooves for tendons that are traveling posterior to the lateral malleolus. Which tendons are those? Those are the tendons that are coming from the lateral compartment of the leg, right? The fibularis longus and the fibularis brevis. The fibularis brevis is going to stop short right here at the tuberosity of the fifth metatarsal, whereas the fibularis longus is going to travel, sweep through this cuboid groove to then reach the plantar aspect of the foot, specifically over here on the medial plantar aspect, and it has a bunch of attachments to all of these bones over here. Okay, that's going to be the fibularis longus. So that's what we see on medial and lateral sides. Another thing we can appreciate on this lateral side is now moving into the midfoot. The cuboid is the most lateral of these bones over here of the midfoot that is all the way out here on this lateral margin of the leg. And then traveling medial to that is now going to be the three cuneiforms. Cuneiforms because they look like the cuneiform tablets that hold the Sumerian alphabet. And so these are named based on their position. This is the most medial one, so this is going to be our medial cuneiform. This is our lateral cuneiform, and then this one smack in the middle is going to be the intermediate or middle cuneiform. Okay, and that's the way we name those three. And again, this one up here is going to be the navicular, which is articulating directly with the talus. All right, and these bones are what make up the midfoot. Next, we're going to have our forefoot, which is going to be formed by all of the metatarsals, the 5 metatarsals, and also the set of phalanges that we have coming from them. So we're going to have all the way on the medial side articulating with this medial cuneiform is going to be the first metatarsal. All right, so they're named 1 through 5 starting on the medial side, always starting with the big one. Okay, same pattern that we saw in the hand. So this over here is going to be the big digit or the first digit. In the foot, we call it the hallux. In the hand, we called it the pollex for the big finger, which I should call the thumb, right? Over here we call it the big toe. So this is the hallux. In the hand we call it the pollex. So the first digit is going to follow the same pattern we see in the hand, having only 2 phalanges coming from it, the proximal phalanx and the distal phalanx. The rest of these metatarsals each have their 3 phalanges: proximal phalanx, middle phalanx, and distal phalanx. Okay, and they'll be numbered 2, 3, 4, and 5. Notice that metatarsal number 2 is the longer one. Metatarsal number 1 is much wider than the rest of the other ones are. And metatarsal number 5 has this big projection of bone over here on the lateral side. That's going to be known as the tuberosity of the 5th metatarsal, which serves as the attachment site for the fibularis brevis. Okay? And then we can look at the bottom side of the foot over here, and we see the same relationship. Let's just point out what we're looking at. So articulating with the big toe is going to be the medial cuneiform. Articulating with these 2 metatarsals out here, 4 and 5, is going to be the cuboid. And then we can see the calcaneus over here, and then the talus right up here, and then the navicular right there. Okay.